Pain. Now that's the one something we would all like to avoid. I'm not talking about the short-term pain, when you cut your finger or you bang your knee, anything like that, but that long-term, recurrent, annoying pain often associated with our musculoskeletal system. I'm talking about arthritis, bursitis, tendonitis. Those nice things that cause the low back pain, the knee pain, the hip pain, all the stuff that makes it difficult to bend over and tie your shoelaces or pick things up, things of that time that really are progressive and interfere with our lives as time goes on. So how do we treat this pain? Well, according to the TV commercials, you're supposed to take all kinds of nice little pills, anti-inflammatory pills, pain relievers. We smear on different types of creams. We have all little kinds of devices that we can put on our back. All these things are wonderful, and they do control and help the pain. The problem is they don't treat the underlying cause of pain. Pain is our body's way of telling us something very simple. Something is wrong. It has to be fixed. Let me talk to you about how the body fixes things. It's called inflammation. Inflammation is the body's first step in repair and healing all kinds of tissue injury. It starts off by increasing the blood flow to the damaged or affected area. The increased blood flow brings in oxygen, it brings in nutrients, it brings in all kinds of healing effects so that the area can be returned and restored to its normal health. Many years ago, doctors realizing this tried attempts to improve the blood flow to various damaged areas. This was especially true in the muscle and joint areas, and they found that they could inject some of the damaged areas with substances that would actually increase blood flow. It turns out many of these things were various types of sugars. They caused the local inflammation, blood flow increased, things got better, and then things cleared up. However, it was very, very limited in the amount of healing and repair that it could accomplish. About 12 years ago, medical science found that by taking the platelets, these are the little blood clotting factors that are in all our blood, taking them from our blood, concentrating them, and injecting them into an area of injury, that this resulted in an amazing increase in the amount of local healing beneficial inflammation, the result being that some of these injured tissues healed up very, very quickly, very, very thoroughly. It was called proliferation, or as we know it today, prolotherapy. It's been used now very extensively in many areas. Many athletes use it to treat any acute injuries that they suffer from. So prolotherapy using platelets is now called platelet-rich plasma, or PRP. It works very, very well, and we've used it extensively in our office for many years. However, the next and most recent step of healing and repair is something which we call regenerative cell therapy. You know it, we all know it as stem cells. Regenerative cell therapy, but again, what is commonly known as stem cell therapy. We've been able to achieve the highest levels of healing and repair, reducing pain, improving mobility to the point that surgical repair or even joint replacement may no longer be even necessary. This represents probably the greatest advance in the medical treatment of musculoskeletal diseases in recent history. Two important things to remember in this situation. Number one, it's always important to treat early on before a condition gets very, very serious. Too often, people will come to doctor's office and with problems of their hips, knees, and so forth, which are so severe that there is no really practical type of treatment. Number two, the older you get, the incidence of surgical complications tends to rise, and the recovery time tends to be longer. It certainly is an important factor in terms of considering something like regenerative cell therapy or stem cells, which is a one-day in-office procedure as an alternative to a prolonged hospital procedure with follow-up treatment. At Integrated Quality Care, our office, our techniques, our equipment are the most up-to-date and effective that is available. I'm sure that you have many questions as to whether this type of treatment is appropriate for you. Please do not hesitate. Give the office a call. Speak to me personally. We offer a free 15-minute consultation to see if we can be of help to you. In addition, please look at some of the other videos which talk about other aspects of stem cells and pain relief. Thank you very much.